Good morning. Welcome to the Vermont House Appropriations Committee. It is Wednesday, February 1. Happens to be 4 degrees below zero outside, so welcome to February 2023. It is 8:30. We are going to start off our day, even though we did have a joke, and we're resonating with that. We're going to start off our day with hearing from the Vermont Veterans Home on their 2024 budget presentation committee. And then, I don't know if you've looked at the agenda, because this is why we gave ourselves some room. So at 10 o'clock today, I've asked JFO to come in and present to the committee the documents that I was over working on yesterday with them for BAA presentation. So there's a 2-page summary that has been refined and yeah, it used to be 3, now it's 2. I got it down to 2. Yeah, 2-page summary and a spreadsheet that I believe you haven't seen that Sarah and Maria will walk us through. So the 4 documents we'll go to the floor with at noon for caucus of the whole. Will be the summary, 2-page, the spreadsheet. Of course, people have the web report and the language, the bill itself. We should have with us, well, if you find it useful, because I was going to start to transfer over to all the B numbers, some of the descriptions that come in on Adam's big spreadsheet about the action that's happening in each one of those B numbers. And I kind of let it go. I don't need to rewrite it. It's there in the spreadsheet. Having Adam's 2-page or 4-page spreadsheet with us gives us in that right, although hard to see, that would be maybe what you might work on underneath B, your number, what that represents in there. So today at, you don't mind holding on for just a second? At caucus of the whole, House Human Services and House Healthcare are out on a field trip today. Yeah, it's like, no, it's fine.
At least it's not tomorrow.
At least it's not tomorrow. So they won't be with us. I don't want you to feel like if people have questions around some of what we're spitting up, like all of the things that they brought new, that I want the chairs in those committees to answer in depth their decision-making process. They won't be here today for that. You don't have to feel like you have to be responsible for those areas unless we know what we're talking about. I'll try to field it. Otherwise you can wait and they can talk with them. But you all will know, or at least have your areas of the budget if it comes up the crosswalk piece. So let me ask this and then we'll talk later, but if you want to have a part of the presentation today, otherwise I'll just kind of do the high view, walk through the 3 documents, and then I'll ask people if they've got questions.
I'm there if you need me.
Okay. All right. So that's the morning. Then we go to caucus of the whole. Take a moment to eat, I think. So at 1:30, I think it's 1:30, Commerce, Government Ops, and maybe Ag, it's still in development actually, are going to come, they're going to present their amendment, which I read this morning, which is like 5 pages. It's like a bill. So we can hit that's going to come. So that we'll hear that amendment today, make a decision on that, and it might make it to the calendar then for tomorrow. Does that make sense? Then we go to the floor. Then we're free. We'll go to the floor at 3. And then you've got whatever you need to do for your budgets then after that amendment. Okay? And it's not free time. It's individual study time. All right. And that'll do today. And then tomorrow we have the morning to hear anything else on amendments. We don't go to the floor till 3 o'clock, so we'll have some time to field whatever people respond to. And everything will be fine, right? All right. Thank you for your patience. So let's call up our witness, the Veterans Home. This is Representative Page's budget area. and I know he's on top of it. Welcome.
Morning. Thank you.
I think we've done introductions.
Yes.
Is there anybody else you want us to?
Well, a former colleague of yours, former Representative Fagan is here as a member of our Board of Trustees. Representative Morrissey is here, great supporter of the home, and Steve McCaffrey, our Finance Director, is here as well.
Thank you, Steve. We may just keep previous Representative Fagan, just.
That's between you two.
Great. So without any further, if you'd like to start for the record and come and tell us what you've got to say.
My name is Melissa Jackson. I'm the CEO of the Vermont Veterans Home.
My name is, Asa Morin. I'm the COO of the Veterans Home.
Welcome again.
I was going to start with the PowerPoint document, if that's okay.
Yep. Do you need it up on the screen or
I have it.
just we're fine?
Yep.
Is it, I'm going to assume it's on our webpage, so people who are watching on YouTube or at home, because we know they're there, you're going to go find it on our webpage and you can follow along.
Okay.
I don't know. Oh, Representative Mahali's got this.
Okay. Just want to give you a little history. I know not everyone knows about the Veterans Home, and yesterday we were asked repeatedly, the statement was like, oh, you're an agency of the state of Vermont. Yes, we are. And our mission starts with a promise. Our vision is to fulfill the promise, caring for veterans of Vermont and their families. And that comes from Abraham Lincoln's promise to care for he who has borne the battle, his orphan and widow. And our mission is to provide the best in class of healthcare services and advocacy for our veterans, their spouses, Gold Star parents, by honoring their choices and respecting their right for self-determination. And you'll see some pictures of that throughout our presentation. And we fill Governor Scott's priority by protecting the Vermont's most vulnerable, in this case, our heroes. I want to call attention to the graphic on the right of this page. We are a 5-star CMS, which is a Center for Medicare and Medicaid Services nursing home. They do a 5-star rating for all nursing homes across the country. We are the only one in Bennington County, and we are only one of 7 in the state of Vermont. So very proud of my staff and the hard work they do. The next page goes on to further explain the promise. It fulfills our promise to ensure that the service of our veterans is not forgotten. They've answered the call and defended our country, and for that reason, our staff is here for them. So as I would tell my staff, every day we work where they live, they do not live where we work. So our campus is truly their home. We have been around since 1884. Our first person was admitted in 1887. At that point in time, they were called inmates. We no longer refer to them as that.
Thank you.
You're welcome.
Oh my God.
It was a self-working farm, hence the Deer Park is the last vestiges of that. And we are governed by a board of trustees. Going on to the next slide, what is a state veterans home? People ask that. Why is a state veterans home not part of the VA? And per federal statute, state veterans homes are facilities that provide nursing home, domiciliary care, or in Vermont terms, residential care, or adult day health. They are owned and operated and managed by the state. To participate, we must be federally recognized by the VA. The VA does not own or manage state veterans homes. There's currently 168 state veterans homes across the country, more being built every day. We have VA reimbursement. So you would think that everybody who comes to the veterans home, the VA should pay for their entire care. They do not. We'll talk a little bit about more of that in a moment. But every veteran receives what's called basic per diem. It's a daily rate that the VA pays for their care. And currently it's $127.17 for the nursing home and $54.89 for the DOM. So if they are private pay, we use that as a discount on their pay, their daily rate. Medicare, Medicaid, it goes towards their cost of care.
Sorry to interrupt you, sir. Can you describe what that is for some people that might not know what the domicile?
Yeah. we call it the DOM because it's a mouthful. It's a residential care level 3. It's like an assisted living. We have 8 beds of that. Our veterans can come and go. We have a few that drive. So we basically provide them meals, help them with their medications, that they can do all of their activities of daily living, bathing, dressing, that kind of stuff on their own. In our case, it's an actual wing of the nursing home. Most other state veterans homes is a totally separate building.
Is it correct that some family, I just recall when we visited a long time ago, there was the widow of a veteran who was able to still.
Yeah, she's still there.
She is. Great.
One of the things is because we only have 8 beds of DOM care, we have grandfathered her in, and going forward, that will only be for veterans just because of that. But yeah, no, she's still with us, very active, visits us quite often, right down the hall from our office. So we receive about $7.9 million of VA funding for our veterans. And this year we're asking for $4.1 million, almost $4.2 million in general funds. So the second type of care that is paid for by the VA is called what we call full cost of care. So when the Veterans Administration designates somebody as 70% or more service-connected disabled, they will pay us a daily rate of $491.36 per veteran. That's an all-inclusive rate, medications, room and board, physician visits, and we cannot bill other insurances if they have that. So when you come to our facility, we have a lot of people using walkers and wheelchairs, and people say, well, why isn't the VA paying for everybody? There has to be an illness or an injury that relates back to their time of service. The governor spoke yesterday about the PACT Act. We'll be working with the VA as well as some local veteran service officers to review our veterans to see if they may have additional service-connected disabilities that may move them to the VA rate. So we'll be working on that. So on an annual basis, the VA stipend is annually $2.9 million. Our DOM stipend is $140,000, and then our service-connected dollars are $4.8 million per year. So
I'm trying to track along on this really nice narrative that you broke out. Okay, what page are you on? Or
on this, I'm on page.
Oh, okay, never mind.
So I'm on slide 11, sorry.
Okay.
So who are we today? We are a premier residential campus for veterans, their spouses, and Gold Star parents. 130 of our beds are nursing home beds. And as we talked about in budget adjustment, we do have 25 of those beds offline due to staffing issues. We have an 8-bed domiciliary. We are budgeted for 200 employees, but as we talked about, we have several open positions in budget adjustment. We do short-term rehab. If you have hip replacement, unfortunately had a heart attack, need to get back on your feet and go home, we do that type of care. Our long-term care, we have an internationally recognized memory care program. It's called Namaste. It's new for honoring the spirit within. It's an incredible room where our veterans with dementia can go and have care provided in a very soothing environment. It's done in recliners, warm blankets, sensory stimulation. Really great room. This program started at the Vermont Veterans Home and is now international. Several countries all over the world. So we're very, very proud of that program.
It is very nice.
Yeah, I'm having a tough day to try to sneak in there, but they won't let me stay.
It's like to replicate it in this building here somewhere. Yeah.
It's one of the great benefits of that is, with dementia or PTSD, a lot of times there are verbal and physical behaviors, and this is an alternative to medication as an intervention, which is one of the things we really strive for. We do hospice care. We have a contract with 2 local hospice. We do a lot of respite care where people have their loved ones at home, may want to go on a vacation, have their own health needs. Their veteran or spouse will come and stay with us for a little while and go home. More often than not, they actually end up staying with us forever because they love us so much. So we do offer that. And we do have outpatient physical, occupational, and speech therapy. And we are finally, after COVID, reopening our guest room. Right above our offices is a fully, like a hotel suite. Family members can come and stay free of charge, especially great for when they're coming from other parts of the state, or at end of life, they can be right down the hall from their loved one. So I mentioned earlier our 5-star rating that encompasses a 5-star for our staffing levels, 5-star for our quality measures, which is various aspects of care that CMS rates us on. And as I talked about it, we're only one of 4, only one in Bennington and one of 7 in the state. So, continuing to sing my staff's incredible accomplishments, U.S. News and World Report acknowledge us as one of the best short-term rehabilitation facilities in the country. This rating looks at patients recovering from hospital stays, heart attacks and strokes, or injuries. So we're one of 16% in the country to receive that award.
Nice.
Yes. And then the next slide is our Pinnacle results. We pay an organization called Pinnacle. They call 1/12 of our population every year, both family members as well as our veterans and members, and ask them about our quality of care. And we consistently are above best in class for the national average. And you can see on the right-hand side of the page, all of those areas that we exceed national benchmarks.
So that 4.76 is out of 5?
Yes.
Nice.
Yep. The next page just gives you some of the comments from our Pinnacle results. Just so you know, we get these every month. They get shared with our department heads, and anything less than a 4, our department head follows up either with the veteran or their family member to see how we can improve and address their concern. Slide 23 shows us our general fund request history. Again, this year it's almost 4.2 million. We'll be back for budget adjustment, obviously, as we receive our funds from the Medicaid upper payment limit. Yes.
Oh, sure. Go ahead.
Thank you. So there's clearly quite a jump from FY20, and that was probably the pandemic. So assuming that's an anomaly, if we were to go back to FY19, would it be still around the 2.8 or the 4 million? Where do you know off the top of your head prior to the pandemic?
The numbers are artificially skewed. This is the term I want to use, because prior to FY21, we were building in what we anticipated our Medicaid upper payment limit to be. And in discussions with the Commissioner of Finance, we pulled that money out and now track it through budget adjustment. So that's why it looks.
Oh, okay. So we'll just.
Valid question.
So, but then you jump up quite a bit between 22 and 23 by 1.2 million. So what was that?
22 and 23 was definitely a direct impact of COVID, the agency staff, the cost of PPE.
That's right, the traveling.
Yes. Yeah.
Got it. Okay, thank you.
I don't know. Are you ready? Okay. Thanks.
Thanks for providing this, total funds, general fund to try to help us. So I just want to repeat. If we're looking at fiscal year 23, the 4 million general fund, does that include what we just did in the budget adjustment?
No, it does not.
Okay, so if we included that, what would that 17.4% become?
You do quick math in your head over there.
I would think a board member could handle that.
Oh, yeah. Do you have one in mind?
Steve McClafferty, Finance Director for the Vets Home. It'd probably be closer to like the 20%.
Okay.
The general fund, if I'm looking at the budget adjustment for 23 alone, I did not bring those.
No. That's fine. I'm just trying to get an idea. And all we see is the trend. I applaud you for the 5-star rating in care. And I'm not at all suggesting that we cut our level of state funding, because this is important work you do, and I applaud you for being in the top tier. However, we still have to look at the money. If we assume 20% that is state share, how does that compare with other state veteran homes?
So
maybe they're only 2-star. I don't know.
I can't comment on their star ratings, but I can tell you about how some of the homes are funded. So the National Association of State Veterans Homes, which we're a part of, and I am previously the president of that organization, we have a saying that says, when you've been to one state veterans home, you've been to one state veterans home. The state of New Hampshire fully funds 100% general funds their home. Massachusetts,
They do that. I mean, they don't
Have to-
use any federal funds?
they have, they do take some VA funding, but all of their they're not Medicare, Medicaid certified like we are. So each home is done differently.
Okay.
Massachusetts is becoming Medicare, Medicaid certified, but prior to that, the veterans paid a monthly amount, which I don't remember what it is, and then the state filled in the rest. Yeah,
So the 20% may not be out of the norm.
right. Each, like I said,
If it is, it's on the low end out of the norm.
I would say yes.
Okay. No, thank you. That's helpful.
Oh, all right, you good. Lynn and Representative Dickinson and then Representative Mahaly.
Okay, so you're Medicaid and Medicare certified. That $471 that you get per nursing skill, does that include your Medicaid, Medicare, or is that just the rate that you need?
The initial rate I talked about on the VA, that's the rate right from the VA. That's specifically for those that are service connected.
Yeah,
Further down, we'll talk about our Medicaid, Medicare rates, which are different.
because I'm looking at if you are, I mean, Medicaid, Medicare are, well, Medicare doesn't pay for skilled nursing, number one, by my understanding, but Medicaid does. Many of our nursing homes are, in fact, mostly Medicaid. Their payer mix is mostly Medicaid.
Exactly.
So are you going to be getting to the cost shift, or how you handle that, or how does that work?
Sure. So there is a waiver that AHS got for us on the state level, which allows us to get full cost for our Medicaid residents. So right now we get an interim rate of $475 per day for Medicaid. And then when we come back for budget adjustment, we're getting what's called the Medicaid settlement or the upper payment limit number. But what is it for this past year, Steve?
4.1 million is in the budget adjustment
Right.
this year.
Our full cost of care for the Medicaid is approximately $720 when we submit our Medicaid cost report.
The 471 for the service-connected veterans, we cannot bill any other Medicare or Medicaid to receive more funds for them. So that's all that they
The
get.
471?
Yeah.
Right. But for other people, let's say a spouse,
Yes.
you can get 720 when you add everything all together for Medicaid. Full
Correct.
cost. Okay, thank you.
Actually, our highest revenue is Medicaid because of this waiver, which in the real world would be the total opposite. So we're very, very fortunate that the state has obtained this waiver for us.
Is that
We could-
how, is that gonna last forever?
I think it's done on 3-year increments. That would be a great question for AHS because they take that. So,
Is that the global commitment?
yes.
So you're under the global commitment?
Yes.
Okay, that's the way, okay, thank you.
Yeah.
And where are you in the 3-year process?
They just renewed it. So,
Thank you. Are you done, Representative Dickinson?
Yes, thank you.
You're welcome. Just want to make sure. Representative Mahaly.
Thank you. Can we go back to slide 10?
sure.
What I don't know about all of this, I could fill buckets here. So you went over, could you go over this a little more slowly?
Sure.
What these three are and, what is the VA stipend?
So the VA stipend is a daily rate that we are giving for all veterans in the facility unless they are what we call the full cost of care, that 491 rate.
So the VA gives you, transfers to us, to you, $127 for everyone in the facility.
Every veteran in the facility.
Every veteran,
Because
right.
about 25% is spouses, so they're not
Yeah.
eligible for that. But yes,
Okay, all right. And that's 2.98 million.
Yes.
Okay. Then and the DOM stipend, where does that come from?
that is also VA money for all of our veterans who were on the DOM. So our census over there right now is 7, but 6 are veterans. So we get that for those 6 individuals.
Right, and the DOM again is for people who are pretty independent.
Correct.
Right, et cetera. And then the service connected,
That ties back to the information on slide 9 that they're 70% or more service connected disabled.
yes,
Right. So that's where,
That's people who've been injured while in service.
correct.
This is, again, what's the source of this?
That's VA funding.
VA. Okay, so this slide is all VA funded, okay. So does this mean,
Okay.
has nothing to do with Medicaid,
Correct.
nothing to do with Medicare. So anything that you get from Medicaid is in addition to these basic amounts.
Correct.
So when you say that the Medicaid full cost is $720 a day,
Correct.
is that exclusive of this? Inclusive?
It's inclusive of all of our,
Of everything?
right. So when we do our Medicaid cost report, we report on every resident we cared for and the costs associated with that. So that's $700 on average.
Is everything. That is that's your total budget divided by the amount of the weighted
Yes.
cost is 720. Okay. I think-
Clear as mud, right?
So, no, so this is VA input.
Correct.
Then, I mean, if you think of your budget as a bucket, VA input, Medicaid input, payments by veterans.
Correct.
Input. Is there, and Medicare.
Yes. And
Any
then
other?
general fund.
And general, oh, yes. Thank you. Actually, that helped a lot. Thank you so much.
No, you're very welcome.
You're welcome. Representative Page?
Yes, your service-connected amount, 491.36. There are some service members that do have a service-connected disability.
Mhm.
Is this on top of what those individuals would be getting? Is this separate?
This is separate. So, yeah,
So they get to keep what they're currently receiving?
Correct.
I guess from the.
yes.
Yep.
What Representative Page is referring to is when you have a service-connected disability, the veteran in the community receives a monthly dollar amount. So when they come to us, they keep that monthly dollar amount and the VA pays us the $491.
This is tax-free by the budget.
I'm signing up as soon. We have Melissa, are you okay?
Yeah, go ahead, Steve.
Madam Chair, just to let you know, the current 1115 waiver, which takes care of the Medicaid upper limit, it expires December 31st of 2027. It was just renewed last July. So.
Yeah. Thank you, because we know that there was a few things that didn't make this last waiver that we were hoping to get done. So I have a question.
Okay.
So the 4 million, I think back on, would it be safe? Let's see, that is on slide 15, 33, right? So when we're looking at FY '23, general fund, 4 million, that's the settlement, or is it not?
That is not the settlement.
Okay, so would it be safe to say that those things just offset each other?
No,
No, okay.
it's in addition to.
So it's in addition to, I just want to make sure that I'm not looking at that thinking, oh, good, they cancel each other out.
Unfortunately, they do not. I wish they did.
So the settlement money is actually is a part of the 23 million there, not the year 23.
That's true.
The total funds?
Yeah.
Anyway,
Yeah.
I'm getting a yes. I got it, okay.
All right.
Keep going.
All right. So moving on to the next page. So
Where are you now?
I am on
We just went back to 15 year on.
24. Yeah, it's number 24. Our page numbers are off. We will fix that for next time. I apologize. It looks like this.
That helps a lot.
So this is just explaining that the current general fund request is a total of 17.4% of our budget. Understanding that figure will change when we come back for budget adjustment.
That doesn't include the general fund that goes into the Medicaid.
So
Does it?
it does not. We could already capture that under our Medicaid funding. We look at that as Medicaid revenue.
Right, but whatever it is, 45% of that's, general fund.
From the total state budget or?
No, the Medicaid is federal and state. So if you're looking at Medicaid, $100.
Right.
Maybe
50 of
$45 or $40 of that is state money. I'm just asking you, you're not
The global
counting that?
No,
Okay.
no.
Where does that show up?
in global commitment.
Global commitment,
Including the state share, yeah.
right. Right, I just,
Okay, I think, yeah, you guys track it at a different, I'm not.
we need to understand what's our state commitment in total. The Medicaid may be there whether they're at your facility or whether they're at another facility.
Okay.
So, but whatever, I'm getting caught up in the weeds, sorry.
No, that's fine. If there's a different way you want us to present this going forward, let me know. Okay.
No.
First time we haven't asked that question. That's why I'm kind of got the deer in the headlights. My brain is.
Lots of people, to global commitments are new for many people coming to and others that understanding that global commitment, when we say global commitment, there's a big piece of it. This is where Representative Harrison is trying to provide some education that when we say that word, built into that number, there is some state dollars. So even though we say global commitment at this line and then general fund here, actually there is some state dollars there.
Right.
Yeah, and that's what you're trying to be clear.
Right, and those would be spent,
Anyway,
whether it's
Right.
your nursing facility or somewhere else.
yeah.
Okay.
He was trying to be an educated moment, right? Okay.
Sorry, I messed that up for you.
Oh, you did.
Pass through and I have to grab them when they, or I'll miss it.
Yeah.
All right.
Representative Dolan, please.
Thank you and good morning.
Good morning.
Could you speak to whether you're meeting the demand for your services in your establishment, the home?
We are not meeting our demand. We have a very long waiting list. The main reason for that is we have the beds offline because the agency / traveler, however you want to refer to the nurses that exists, is just astronomical. So we made a conscious effort to determine what a good number was to provide some care, but also not ask for another 10 or $12 million in general funds to cover the additional agency staff. Our biggest need is on our memory care unit. We do have some beds over there, but we are admitting very slowly. One of the budget challenges you'll see is the behaviors associated with that, tied into, as we know, like all states, the lack of mental health services. So, yeah.
Thank you.
So add to that, and then Representative Page, if I recall, there was, you actually did a reduction in how many beds you serve in order to fit. You made an adjustment that.
Yes, a few years ago, we took about 25 beds offline, or got rid of the licenses.
Yes.
These 25 beds that we're just holding and not filling right now.
Right, because it just was not able to meet the staffing needs to keep them open, not because there's not clients, because there's
Exactly.
a few, yeah.
How many nurses do you have per patient?
We do an hourly average. It's 5 hours per patient per day. That is about 2 hours of nursing care, RN, LPN, and then 3 hours of LNA care, which is well above the state minimum of 3 hours, but it accurately reflects our acuity of our veterans and members. The increased need for behavioral health intervention, higher care needs.
Go ahead.
Just a comment. I know you're meeting the needs of veterans, and that's wonderful. And you've cut the number of patients down for your nursing home. But as we all know, there's a lot of other nursing homes out there that are, just filled to capacity and continue to be that way, and yet probably aren't meeting the staffing needs like you are at the Veterans Hospital.
Mm-hmm.
Just
Oh,
a
yeah.
thought,
It was a tough few years to get adjusted to where you are now.
Yeah.
So congratulations on that.
Thank you.
Yeah. It's a tough decision to be able to right size to maybe, keep the staffing, keep the funding, not be in a.
We get, Asa and I and our admission staff get the calls every day, the heartbreaking calls. There's nowhere else to go. What can we do? And we try to refer them out to other community services, so it is a double-edged sword because we know that there are people in need that we can't care for right now.
Yeah, and yet some facilities up in your,
Just
that's
all
your
over,
area,
Just all.
right,
over.
that just closed, that,
Yeah.
I mean, he was just so gracious, the gentleman were, and I can't remember the name of the place, but, they had to close because they didn't have staffing. And he spoke so eloquently about the fact that, well, maybe the only silver lining out of this is that the staff that he does have can now go work at the other nursing homes in the area that hopefully will relieve their workforce issues.
Yeah.
Okay, on that cheery note.
All right, well, I'm going to show you depressed. More depressed. Or on this slide here, this shows just a snapshot of our budget. I think this slide is very important and it speaks volumes. The 74.1% of our budget is basically that part of our budget. We have no ability to control the expenses. Salaries and benefits, allocations, our lovely heating and cooling expenses and those type of things. And I feel we do really well managing the 25% of those things that we can control. Short of giving people one pencil or one paperclip at a time, I think we're at a good spot. I mean, we've looked and we continue to look at how we can save money. Always looking at the acuity of our residents. Do we need that many travelers? So.
Representative Shai has a question.
On the salary and benefits, are the staff part of a collective bargaining unit with the state?
They're the state employees, so they're
So
part
they're
of
VSEA?
Yes.
Okay, all right. I wondered how that worked. Okay.
So the next slide gives a little bit more detailed breakdown to the 74.25% as to what we can control. Basically, we have control over our food, our pharmacy, medical supplies, our rehab services, and our our medical services. Us, like the rest of the world, are facing inflation. You'll see further on, we have some major supply chain issues. For a while, we couldn't get pasteurized eggs, then we couldn't get Oreos, which is a major crisis. So we're all out at Walmart or Price Chopper or whatever the local supermarket is clearing the shelves. For a while, we couldn't get a certain soda. So we have the same challenge. Coffee.
Really?
Can we take your coffee back with us? So we have those challenges as well, and we try to do our best. The slide after that breaks down, the slide here, so we collect 83 cents of every dollar we need to operate. And this breaks it down as to what our payer sources are. So 41%, almost 42% is our Medicaid, Vermont Medicaid. Almost 7% is private pay, 1.5% is Medicare, 20% is that $490, the Medicaid, VA full cost of care, the service connection. And then 13% is the VA stipend, and then it's less than 1% is the DOM. You'll notice that out-of-state Medicaid is at 0%. Many years ago, we looked at bringing in Medicaid from other states as a help for our funding. They do not qualify under the waiver that we have. So I felt it was through attrition, we got rid of all the other state Medicaid at $245 a day to ask Vermont taxpayers to subsidize a non-resident and an additional $500 a day. I couldn't justify. We will help out-of-state veterans find other places within their state, but we're no longer in the out-of-state Medicaid market for that reason.
Yeah, I recall the whole mission that went out to look in Massachusetts, New York. Representative Shai, go ahead.
So that reminded me to ask you, are all of the veterans who use the home from Vermont now, or do you have out of state?
We have out of state. If you're private pay, VA service connected, you can come from any state, but predominantly now, if they're on Vermont Medicaid or Vermont residents.
So do you know about how many are out of state? And is it preventing Vermonters from being able to get in because they're out of state?
No, our charter and our bylaws say Vermont veterans have priority.
Okay,
That they will always be the focus of our mission.
thank you.
Welcome, Representative Mahaly, and then Representative Dickinson.
Is private pay includes insurance, right? Private insurance.
Yes. Yeah. We have very, very little of that. probably have one or
It's
two.
not, it's just mostly actual payments by the family.
Yes,
And the gap between revenues and expenses, reimbursement,
that's where the general fund money is.
that's the general fund. Okay,
Yes.
got it. All right.
Good. Representative Dickinson.
Okay, 720 is your full cost, so that's what the private pay people pay.
No,
What do they pay?
they pay $385 for a private room and, yes, I don't know if I always get that.
Is that the DOM or is that the skilled
That's,
nursing?
that's a skilled nursing.
Our semi-private rate is $315 a day, and our private room rate is $335 a day. That's what we would be charged. And the DOM is $100.
That's the full cost. If they're private pay, that's what they pay.
Correct.
Okay. So where is, so the cost shift comes into the general fund?
Yes.
Okay, thank you.
Good. Representative Page.
Yes, what is the definition of a Vermont resident? Let's say I'm a Vermont resident and I move to Florida and become a Floridian resident. And then I get ill or something and my family can't look after me. They want to ship me back to Vermont. Would I still be qualified?
So yes and no. So when I started in this position, one of my first encounters was a former Commissioner, Jim Reardon, God rest his soul. And, he reminded me that you can move into Vermont and become a Vermont resident day one and be put on Vermont Medicaid.
Yes.
So we really look at that and we would, if we had 1 million open beds and you were coming in, I would say yes, but if I know you're coming in to be immediately put on Vermont Medicaid rolls, we may have you wait and take someone who's been in the state a while. So yes, you can, but right now, based on our bed and our waiting list, you wouldn't be admitted right away.
I'm not planning on coming.
Some nice beds.
Or moving to Florida, right? I was saying to Representative Henderson, we need like the legislative retirement home place. We just pretend to do bills on the floor, right? No, you didn't have a question. I'm sorry.
The next page with the honor and remember flag just goes over, shows you our expenses. The decrease in the salaries and benefits obviously is a direct reflection of taking into account all of our open positions. Obviously, we are filling some of those open positions with agency traveling staff at a higher cost. Our goal continues to be to hire our own staff and reduce that.
I mean, it's amazing that you have 13 openings for RNs, right?
Yep.
The average hourly rate is $49 an hour.
Is the 8 million, why are the non-salary up? Is that because, do the travelers go into non-salary?
Yes,
Yeah.
travelers, inflation,
Yeah.
cost of
Yeah.
living. Yes.
So when I'm looking at this, what is the total staff? It's interesting to see, when you see 33 LNNs open at $30 an hour. I'm not too sure what page we're on.
It's
or-
the average pay, not the starting pay,
Not the, okay.
unfortunately.
So I was just wondering, in comparison, how many LNNs or how many staff do you have?
Which one are we on?
We're looking at this.
Yeah,
This is about half of our nursing staff that is open.
okay, so that gives you a perspective. It's like, okay, half are open.
Yeah. Yeah.
Well, Representative Page, maybe we can go get a job. I don't know. All right. But that's difficult. I'm not making light of it.
No, I know you're not.
Hard.
I'm quite sure every agency that does healthcare that's testified in front of you has had the exact same experience.
Seem to be within the 30 to 50%, whether it's the DAs, SSAs, or people, home health and hospice. Yeah.
So just go back quickly a couple pages. The Board of Trustees has developed a strategic plan, and these are the goals. We are currently finishing up a contract with a firm to do a marketing study the focus of this marketing study will be to determine how many veterans are in the state of Vermont. What services do they need? What services would they like? And asking the question, as General Knight and Bob Burke said yesterday, have you served? Not asking if you're a veteran, have you served? So we can really determine what our catchment area is, who our clients are. And based on that, we would look at, are we going to branch out in different lines of service in the future? But the first step is knowing how many vets are.
Representative Scheid, please.
It's nice to see that you have a strategic plan, and I'm wondering if one of your points might also include strategies to reduce the number of traveling nurses and have your own staff, increase the staff.
That is part of our internal quality assurance performance improvement plan. We actually
Financial health.
Yeah, kind of falls in there too. But we also partnered with VCPM, their program. You want to talk about that, Asa, because you're part of that and how the little project they have going?
The Vermont Certified Public Managers Program. So I'm in that program right now, but another group from our cohort is working with us on a project of how, best strategies for recruiting and retaining employees. We also have been working with the hospital, the psychiatric hospital, to share ideas. And we're not competing for their staff because of our geographic location, but how do we get nurses to want to work for the state versus want to work for a traveling agency or a private company that can offer different things in terms of salary?
So just following up on that, and I'm sure I'll get corrected from the sideline if I get this wrong, but I think last year we put something in the budget about an LNA program where they would do their clinical training at the Vermont Veterans Home with the idea of trying to increase your actual staff. So did that happen, and how's it working?
We have an LNA. We always had an LNA program.
Okay, maybe it was.
Yeah, one of our staff members is taking advantage of the LNA to LPN program right now. Yes. So she's been with us for a long time. She's having a great experience. She's out sharing that with her staff, her fellow co-workers. So this agency will pay $4,000 towards her tuition, and then she's got to stay with us for a year. We did sign a letter of support. The Vermont Healthcare Association is looking at something similar from an RN to a BSN program. We've had Vermont Tech in to do their clinical rotations. What it boils down to is our inability to recruit. And we've had some of our staff leave to go to the agency. Young. I don't really worry about benefits. I don't have a healthcare issue right now. But as you can see, if I can make $70 an hour vice, $30 an hour, I'm going to go there and do that and then figure out benefits and retirement when I get older. It's that dollar amount that is really driving this market. Had conversations with our federal delegation about, in my personal opinion, it's a racket. I mean, they seem.
Yeah, I agree.
Yeah.
And it's not just with you, it's.
No, it's small, but yeah.
Yeah, thank you. I've got a couple of questions here. So where do you go to for nurses? Do you go to the old Vermont Southern University? Do you go to Castleton? Do you go to VTC? Obviously, you do go to VTC. CCV. I mean, we're looking at stackable credentials all the way through. I'll just throw it all into one big question. Do you do tuition reimbursement? If you get a LNA who wants to go on LPN and they go back to school, do you reimburse as they go to an RN, et cetera? I mean, that's the way we're trying to work with nursing shortages is stackable credentials.
State employees have access to a state tuition reimbursement. We're looking at merit bonus programs to see how we can additionally offset some of that funding. We have Castleton came in, but unfortunately, I love we have a great relationship with our local hospital. Mm-hmm. But if you go to Castleton and work at Southern Vermont Medical Center, they'll pay your entire tuition.
Who will pay your entire tuition?
The hospital pays their.
Southwest will pay the entire tuition for Castleton. Mm-hmm. Do they pay it for anything else?
I don't know.
Is that just out of Southern Vermont, or is that at the main campus of Castleton? I mean, because they're all over the place.
Right. It's
they go through the main campus, and they have a satellite campus in Bennington.
Yeah. Did that help any, or is that just part of the same problem?
They still have some agency staff there, but when those students will come and do their rotation in our building. They'll say they love us, they like our mission, but.
They can make more money somewhere else.
Right.
Yeah, the
And have
incentives
someone-
are all screwed, yeah.
Yes.
Okay.
And the state reimburses 80% of tuition versus 100%.
Okay.
So that
All right.
20
That
can be a
helps.
good chunk of money.
Yeah, yeah. Non-traditional students, you're recruiting all those, that's really the,
Yeah, we work very closely with the Department of Labor in making sure that they're including us in all of their highlighted programs and job fairs and different work programs. Or if somebody needs a job coach, we'll have them come over and work with us too. Trying to be involved in every program that the state offers to recruit staff.
yeah, because there was a whole lot of critical occupation nursing being like number one for free tuition at a variety of things during the pandemic money.
Good.
Thank you.
You're welcome, Representative Dolan.
Do you also offer housing?
We do not. Yeah,
Has that become a barrier at all? Where you live?
it's actually even just for our regular staff, just the rental cost of Bennington alone, when you're making $30 an hour, it's hard. So housing is an issue. We don't really have the space to build housing on our property. But affordable rents, I'm quite sure it's a state issue, but we definitely feel it in Bennington. Yeah.
We heard from somebody, can anybody refresh my memory? Let's put in, sorry, maybe it's a different subject area.
But back to the initial question about our LNA classes, we have historically done those Monday through Friday during the week. We are looking at doing a weekend only class and a nights class to capture people who may want to become LNAs, but on different shifts and couldn't accommodate a day class. So hopefully in the spring, we'll be offering either one or both of those at nights and weekends, or looking anywhere possible to staff.
Yeah, those 25 beds that.
Quickly on this page with Bob Burke, just to give you an overview of who we care for. So our average age is 82. Our youngest vets is 55. Our oldest is 101. And we have 3, right, that are over 100?
Yeah, 3 over 100. Yeah.
85 males, 20 females, 88 veterans, including 3 females. And we still have 5 World War II vets with us. Yes, going to be missing them when they're gone. 17 in Korea, 49 for Vietnam, 2 for Gulf War, and then 15 for the Cold War. And the thing that really drives our budget, as we talked about earlier, is our higher acuity and care needs, PTSD with dementia and substance abuse, difficult to manage behaviors. I will say one of our greatest successes in the past couple of years is we had a veteran who had to have a staff member with them 24 hours a day, 7 days a week. And through working with a VA psychiatrist, who we are fortunate enough to have 4 hours a week via telemed, that veteran is no longer 24/7 supervision. I mean, he's still in our nursing home, but he doesn't have someone with him 24 hours a day, 7 days a week. So we are looking, how do we manage this? Yeah. But it's the crisis situations that are the toughest for us. But we do reach out when we unfortunately have to send a veteran to the hospital for mental health issues. We'll reach out to the VA and see if we can find some place in the VA. Sometimes down at Leeds, Mass, they'll take them. We always try to take them back and trying not to further someone in the emergency room for weeks at a time. So just some, the next goes over the key budget factors. As we've talked about before, 63% is salaries and benefits, 4% is the state allocations, another 4% is utilities, and then we do pay the Medicaid bed tax on all of our beds, whether we're filling them or not. So we pay the bed tax on all 130 of our beds.
Yeah.
So, and the reason behind that is multifold.
I get a sense from Representative Molly.
I know there's
got a question on that. I don't know. I'm like,
why are we paying tax?
that body language was like there.
Tax is.
So.
So it is a tax at all
Hospitals.
Yeah, all hospitals we pay a bed tax. My understanding is we pay the tax and then the state's able to leverage federal dollars on the amount of money that all of us pay in taxes. So the question is asked, been asked by my board members, I'm quite sure maybe rolling around in your head is, if those beds are offline, why are we still paying taxes on those? Because we're maintaining the licenses for those beds.
So it's a license tax, really.
Right. So if we were to give up those licenses, we would have to go through the certificate of need process to get those back. There's money involved in that. But it's something we're going to continue to look at. Is there a time where we think it's going to be off for a long period of time? And it's about $100,000 a year.
When it's, right, makes sense. But the 25 that you took off are gone. Those are not on your bed tax anymore.
The initial 25, the 25 we're not filling now, we still have.
Okay. Yeah.
Paid
That's a
to the
provider tax.
Correct.
state. Paid to the state.
Yes.
And then the state leverages
Yes.
and then gives it back to you.
So,
Right.
Kind of. Well, we asked for it back in general fund money.
Yes. Get it, right.
so they don't do that automatically. That's part of your general fund request.
Right. I believe the federal matching funds goes back to,
FIBA.
yes. And then- So with our gentlemen playing pinball, so some of our financial challenges, we've talked about the beds being offline, reduce, we don't really have an ability to pass costs, increase costs off to anybody else. Once they arrive with us, they're there. Obviously, our agency staff. And we still struggle with the perception that care should be free at the vet's home. We've unfortunately, in my tenure, have placed liens to get funding, our payment back. We've reported misuse of veterans' money to both APS and the Office of the Inspector General. Because family members will drop their loved one off and they're great, but then they'll think that that money is theirs and not pay us. So it's not something we like to do, but it's something we have to do. And thankfully, it's not as often as it could be. So the next slide is that staffing slide we looked at. Is there any additional questions on that? Before I move on?
Madam Chair?
Oh, yep, go ahead.
Coming back to the 25, I think, beds that you're leaving vacant, is there any way to convert those into domicile related?
We would have
low
to.
Needs, or is it because of actual infrastructure
Part
or
of the
facility?
It's part of the infrastructure.
Wouldn't accommodate that?
We could, by moving beds around, make another domiciliary wing. That's not a huge moneymaker for us. Would actually maybe it may impact our general fund request, and that we don't really have a demand for that. We actually do not have a waiting list for our dom right now. If we should see that switch down the road, it's definitely something we can consider. Okay. So we already talked about the staffing. So we're basing our budget on a census of 110. There's our private room rates, our interim Medicaid rate. So when Steve gives you the figure of over $700 a day for our current cost of a Medicaid resident, we will not receive the additional almost $300 for 2 years. Medicaid cost reports are 2 years back. So yeah, so when I come for budget adjustment, you're going to be thinking one figure and it will be something different.
Okay.
Laying it out there. Try not to have any surprises from us.
Not your fault.
No, but just, so the budget assumption page just gives you what our current daily rates are.
Representative Harrison.
Do you increase these each year?
We have not increased our private pay rate in a few years. The other rates, we have no control over the cost.
Why wouldn't you? I mean, everything goes up every year, it seems, especially today.
Right, it's something that we will be discussing with the board of trustees. That's something under their auspices they have to approve, but we will definitely be asking them.
None of us like that.
Oh, no.
But that's the reality we're in.
Now it's the conversation we're having.
Representative Mahoney.
Are those rates, the rates, the agency staff members, are those the rates paid to the individual or paid by you to the?
Paid by
agency?
us to the agency.
So if someone at our end you pay the agency $100 an hour, 96, how much does the nurse get?
Do you know specifically, Steve, have they told us? No, they don't tell us, but I've heard,
Yes.
I've heard upwards of about $75 to $80 an hour. If what the traveler staffs is telling
Like Kelly Services way back, the olden days.
Provide housing.
So they're taking off 25% or something like that. and-
Yeah.
Yeah.
Yeah, $20, they'd be paying 11.
Right.
You know, I hear you. Feel you. On this slide, it just goes over a lot of the expense challenges we've talked about. Although the price of personal protective equipment has come down, it's not where it was pre-COVID. We are still wearing at least surgical masks every day in the facility, depending on the community transmission of COVID. It may be N95 masks. I can't say enough about Vermont's Department of Emergency Services and all of the various agencies across the state through COVID. They have been so helpful and so supportive of us, making sure we've had everything.
And no supply issues obtaining them.
No, they were phenomenal. The health department, our medical director had a question, he could pick up the phone and talk to Dr. Levine. That's not something you heard about in my colleagues in New York. So we have a lot to be thankful for and proud of in Vermont for how we came through this. We still are testing our staff via rapid antigen tests twice a week. Thankfully, we continue to receive free tests. We have been having conversations going forward about what are we going to do when those run out, because that's would be a cost of almost an additional $1 million a year. So regular testing seems to be being less and less the gold standard with the CDC. So I'm hoping that there will be a point that we're only testing those who are symptomatic Lysol staff in the near future. We talked about our supply chain.
Representative Page has a question.
Yes, going back earlier, you talked about medications briefly.
Mhm.
VA only pays for the meds for an individual that has been injured on active duty, is that correct? Or-
So, yes, when you're at home, when you come to the Vermont Veterans Home, if you're Medicare, we bill your Medicare Part D plan. If you have Medicaid, Medicaid covers your medications. But if you are 70% or more service-connected disabled, our provider agreement with the federal government, and it is in federal statute, so it's something I cannot change, we pay for their medications, which is the largest part of our pharmacy bill. We have one veteran whose medications is about $6,000 a month.
So nothing from the VA?
No, unfortunately not. If we were large enough, which we are not, we could have our own in-house pharmacy and purchase medications off the GSA, but you have to have 300 beds to even make that remotely. Yeah. Okay.
We've got about 5 more minutes.
Okay. So,
Is there anything more in that 5 minutes you really?
no, I'm good.
Well, there you go. Now,
End of it, if you get a chance, when you have your independent reading time later, the very end talks about all the great things we do.
yeah, and if you get a chance to visit, it's really, really enlightening. The grounds are, it's a beautiful place.
Just one thing that we just recently, one of our nurse managers is an avid hunter, and one of our veterans wanted to go hunting, and she made it happen for him. He had a great time. Now he wants to go, turkey hunting?
Turkey hunting in the spring.
Yeah.
Backyard.
Pardon?
In the backyard, right from his room.
No. Within the town of Bennington, there's firearm laws.
Well, thank you.
You're welcome.
Well, this Representative Page has your budget, and I'm sure you've been in contact with him, and he'll be there. So if there's any other further questions, we'll filter them through Representative Page.
Madam Chair, may I recommend that you have Steve here tell you what revenue falls under what column on the.
On the crosswalk?
It's a question this committee always had.
Okay.
I had to ask it every year because I don't remember. So.
For the record, that was Mr. Peter Fagan.
Yes, I'm sorry. Yes, one of the board of trustees for the Veterans Home. Thank you. Sorry about that.
Again, Steve McClafferty, Finance Director. That's all. Where it's under the federal funds, that is VA and Medicare. Under special funds, it is Vermont Medicaid, private pay, and if there's also then a private insurance, but not Medicare and VA, and then general fund is general fund.
Thank you, sir.
Well, thank you very much.
And I appreciate the help. So we actually have your crosswalk.
Last page.
Last page. That's the big one.
I know you're all very busy in the legislative season. But if you're ever in Bennington, nights, weekends, holidays, let us know you're coming. We're happy to show you around. Veterans would love to see you. We are finally all back together in one group, and I love having visitors now.
So are we. We're back together in one group.
I know, it's been great. Thank you so much for your time today.
You're welcome. Thank you, and thank you.
Thank you.
So committee, we have a guest that's with us from NCSL that is going to give us a highlight. So come on over. And then we'll take a break. And then we'll come back at 10 o'clock for Sarah and JFO walkthrough on materials. Welcome.
Good morning, thank you so much. Yeah.
You're reminding me that we're gonna need to do a little signage on the door. I think it'll help direct people
Oh,
on the,
I know, I'm sorry about that.
you don't have to be sorry. It's actually showing that we need a little more help with that because we have two doors. So as people are starting to say goodbye, we'll give them 2 minutes.
Oh, yeah.
You want to introduce yourself?
Yeah, Madam Chair, members of the committee, thanks so much for having me. I'm Erica McKellar with the National Conference of State Legislatures, and I see a lot of familiar faces here today, so I think most of you are probably familiar with NCSL. We are a bipartisan organization that's really dedicated to strengthening state legislators and the work that you all do. We provide research, we put together newsletters, we have an online magazine, try to produce a lot of different materials that we hope will be useful for you. We really want you to think of us as kind of an extension of your staff. One of the big things we do is research requests. So if you ever have a topic that you're interested in or need more information on something, want to know what other states might be doing around a particular topic, you can feel free to reach out to me as kind of your point person.
Representative Mahali is a new legislator, and I wanted to make sure, I know you're busy with there, but if you could, I just want you to make sure that you meet this woman, because this will open many doors for you.
I hope that's true. Thank you for the kind words. Hello.
So we'll give you. All right, come on back, because I don't want you to miss this. Mr. Fagan was great and the public. He is the best.
Well, I was also very kindly invited to the new member orientation, so I know there was a lot of information that was shared, but hopefully you were able to catch that. Yeah, so a little bit about me. I've been with NCSL for about 11 years now. I'm part of our fiscal affairs program, so I work on state fiscal conditions and state budget process issues. And then additionally, I'm lucky enough to be the liaison to the Vermont legislature, which means I get to come here once a year and visit with you all and enjoy the nice Vermont weather. And I just
bring it.
I think I brought it
in the air today.
I think I brought it with me from Denver. It was very cold when I left. But yeah, I get to be your point person. So we have issue area experts in, a variety of different issue-specific policies. I have some A to Z lists I can give you with everybody who covers different topics.
That would be fabulous. If you could send that to Erin.
I can do that, yes.
I find your availability so welcoming.
Great. I'm so happy to hear that. But I know the list can be a little overwhelming. So you can always feel free to just shoot me an email or give me a call anytime. And I'm happy to put you in touch with the right person and make sure that you get the resources that you need. We also put on over 100 meetings a year, either small kind of issue-specific meetings, and then we have kind of our large legislative summit. It's a big kind of annual event each year. This year, it will be in Indianapolis, August 14th through 16th. So I hope you're able to make that. And we're currently working on the agenda, so that should be available online soon, some of the big topics at least. Other things I wanted to mention, we have launched a new website a couple of weeks ago, and we're still sort of in the process of transitioning some of our information and pages. So if you go and you can't find something or nothing's coming up in the search, we probably have something on it, or if it's not available on the website, someone will be able to help you with that research. So please feel free to reach out. I'm happy to to help you get that information.
Great.
Good question.
Sure, go ahead.
Thanks for all you do. It's great. I'm just wondering if you could give us some recent examples of maybe research you've done for other legislators, Vermont or elsewhere in the country, what you're seeing for what people are asking for, or just examples to help us think about. I don't always think about using it. I read your articles and I love all that, all of that, but I don't think about, I can ask them to help me out here. So.
Sure. One thing that I know my colleague Jackson has been answering a lot of questions on are states are using some of their surplus funds to provide some rebates or do some things like that due to kind of inflation. So that I know is a big topic that he's answered a lot of requests on right now. So he answers a lot of requests on who's done that, how they're structured, what they look like. I know affordable housing.
Citizen rebates, kind of like a stimulus check, okay.
Exactly, yeah. There's been a lot of states who've done things like that. I know some states are looking at expanding the sales tax base into some different services and like digital advertising. So, knowing what states have done that and what kind of the bills that were introduced around that might look like. Basically, I think one of the most helpful things is kind of we can do bill research and kind of help you see what other states may have done in a different issue area and tell you who's done what. To a certain extent, if it's been effective based on what the program goals were, if it's something that's been kind of like long-term. We can also put you in touch with folks in other states. So if there's an issue that you're really interested in that Maine has done, for example, we're happy to put you in touch with someone in Maine who can tell you like more specifically how, that may be moved through the legislature, some of the nuances that we may not know as like an outside organization.
I think I heard you also say affordable housing, but we kind of jumped right past it. But what sort of things have been happening with that?
So I think affordable housing is a huge issue across the country.
Forced childcare, yeah.
Yeah, so we at NCSL internally, it touches so many different issue areas. So we have a group that meets, I think they meet bi-weekly to talk about, in our children and families program, what are they hearing from legislators and staff on the fiscal side and economic development side? What are we hearing from the people that we maybe talk to more? And just getting some different groups involved. And then I don't know, I'll have to take a look at kind of what may have been produced around that, if there's any research that they've put out. But I know we've been getting lots of questions on that. So I know that there is research that they can provide to you if that's of interest.
Good. One of the things we've been talking about actually is emergency housing and what are other options besides motels and how do we reduce the need for emergency housing?
And unwinding, come July,
Yeah. So if you have any information on those things, that would be really useful.
Yeah, definitely.
Representative Harrison, you gonna put your order in?
No, but Erica, can you, a couple things, refresh our memory in terms of using the search on the NCSL website and actually getting logged in, especially if you're a new member, you may not have a login operation. And then additionally, do we have, Representative Rogers used to be kind of our point person for NCSL from our own legislature. She's not here any longer. Do we have a new one?
I do not believe in the House that anybody has been appointed yet, but I will double check on that.
And then the last thing I'll mention, Erica, there are several various committees that NCSL hold, and there is an opportunity, the speaker, like for example, I'm on the Budget and Revenue Committee, and it's basically to look at what Congress is doing to hopefully help states, not hurt states. And I think myself and Representative Ansel were appointed last year, or were on that committee, which might involve a couple Zoom meetings during the course of the year, but there are other committees as well. I know there was one for natural resources and stuff. So if you're interested, if you know what they are, and if you're interested, you might want to talk to the speaker about, being one of the 2 Vermont representatives or something. Well, I don't know what the numbers are, but
yeah, definitely. There's
one or something with,
Yeah, there's a tab on our website that lists them all, and you can read a little bit about what they do. But yeah, they kind of craft MCSL's policies around what we allow for in Washington. A lot of, making sure there's no unfunded mandates, that type of thing. So yeah, it's a great opportunity to get involved. You do need speaker approval, but you can also reach out to our staff, our MCSL staff that staff those committees as well, and they can tell you more about each individual committee, because I feel like the titles look kind of broad. So if you want to know a little bit more about what they've been drilling into lately, I can put you in touch with the specific staff that work with each of those committees. They can tell you a little bit more about those. Thank you for the reminder.
You're welcome.
So the search on your website?
Oh, yes.
Oh, yeah.
How do you learn how to do that?
Yeah, so at the top right corner, I think it's still in the top right corner, there's a login button. And if you hit login, it is associated with your Vermont email address. And if you put that in, it will either prompt you for a password, and if you haven't set up a password, it should prompt you to set up a password or reset a password. And it should be easy to do, but if it's not, our IT team can absolutely help you do that.
Login failed. Shows you how often I.
Uh-oh.
So I got in, and I don't know if I'm on the new site or not, but I got in with an old password.
Oh, yes, the passwords shouldn't have changed unless you've
Okay.
changed them, yes. It's an internal moving over to a new platform and, trying to modernize a little bit, so. And I know, there's so much information on there, so trying to find it can be difficult. So we're trying to make that easier, but again, if there's anything you can't find, please feel free to reach out to me.
Go ahead,
Yeah.
You had the best program, and I think you only did it once. It was in June of 2019. I went to DC, and it was a budget and tax academy.
Ah, yes.
And we went to the Pew Charitable Trust. We had dinner at the National Press, whatever we did. And we stayed at the Intercontinental, and the people were fabulous. Some guy from Moody's came and talked about recessions, and it was just wonderful. And I was trying to tell people, I was on Ways and Means at the time, and I was telling a colleague who's now on Ways and Means. Plus I met some great legislators, but I don't think you've had it since then, because the next year was COVID.
Right.
And then, so I don't know if it's migrated to online, but I just think that was a very worthwhile conference or whatever it was.
They had it this summer.
Did they have it this last summer? This past summer?
I think so, yeah. But I don't know, I know it's funded by the Pew Charitable Trust, and I know we're in contract negotiations for what sort of deliverables and stuff we'll be doing this coming year after July 1st. So I'll mention that is a very valuable resource, and also mention if it's something you're interested in attending, again, I can let the staff who work on that know.
Great, thanks.
Representative Mahoney?
Actually, I can't get it.
Okay.
You need to can, or you can.
If there's no, it says after, there's just, if you aren't sure if you already have created an NCLS account, or if you need to reset your password, click account lookup. And there is, okay, now here it is, okay. It wasn't, okay, I'll try again. Create an account.
I am absolutely not a tech savvy person.
Okay.
Hope that works.
Yeah, I'm
If not,
gonna
I'm
have to,
happy
in order to do it, I'm gonna have to,
Take a break, come back in time.
okay,
I
I'll try.
think too, yeah,
Okay,
So we're gonna let you continue to do that. If you're good, we're gonna go off live, and we're gonna take a break. We're gonna come back at 10 o'clock, where Sarah's gonna walk us through the documents that we're gonna take to the floor. So
People can chat.
people can chat if you've got time, because I know your next appointment's at 10.
but I.